Hello, my name is Berktoy. I'm a healthcare professional with experience in medicine. Today, I will be discussing some tools and strategies for healthcare providers they can use to promote patient safety and quality of care in the healthcare settings, including morbidity and mortality conferences, audits, and case scenario where these quality improvement strategies will be applied. Okay, let's start with the definitions of the terms morbidity and mortality. And the morbidity refers to the state of being unhealthy, diseased, while mortality, as you can imagine, is the state of being dead. So there is a difference between morbidity and mortality as the meaning of one is a living being, one is deceased. And morbidity in medicine is often used to refer as the prevalence and incidence of a particular disease or health condition, and it can be measured by various ways, such as through the number of cases reported or hospitalization rates and disability adjusted life years. And disability adjusted life years corresponds to the burden that combines years of life lost due to premature death and the years of healthy life lost due to disability, which means the from the time that the patient is diagnosed with the disease to the time where the patient would have died if they wouldn't have the disease at all. And mortality, on the other hand, is often used to measure the number of death caused by a disease, a particular health condition. And mortality rates can be measured by dividing the number of deaths by the total population, or by the number of cases of disease. And let's say we are interested in studying the impact of diabetes on a population. Well, what we could use morbidity to measure the prevalence of diabetes within the population by extracting the number of individuals who have been diagnosed as diabetic patients or who are receiving the treatment for diabetes. And this information can help us understand how common the diabetes is and within the population, and whether it is increasing or decreasing over time. We could use mortality to measure the impact of diabetes on the population by having information on the number of deaths caused by or attributable to the diabetes, like attributable to the disease. This can help us understand the severity of diabetes and how it may be contributing to premature mortality in the population. So by looking at both morbidity and mortality, we can see a complete picture of the impact of the diabetes on a population and develop targeted interventions to prevent and manage this disease. For example, we may develop public health campaigns to encourage healthy lifestyle choices and diabetes management, or invest in research to develop new treatment modalities in diabetes. In addition to their use in public health research and policy making things, and morbidity and mortality are also important concepts in clinical medicine in healthcare settings. Healthcare providers use these measures to assess the health status of individual patients and monitoring the effectiveness of treatments. One important tool for promoting patient safety and quality of care in the healthcare settings is the morbidity and mortality, in short, M&M conferences. And these conferences are regular meetings where healthcare providers are review cases of adverse outcomes and unexpected events to identify opportunities for improvement in patient care and safety. And during M&M conference, the healthcare team involved in patients' care will review case to identify any issues that contribute to adverse outcome, and they will discuss factors such as the timeliness and appropriateness and the appropriateness of the care the care they provided, and the effectiveness of communication and teamwork among the healthcare providers, and the adequacy of patient education and follow-up care. And by reviewing cases in this manner, healthcare providers can identify areas where care can be improved and take steps to prevent similar outcomes, these adverse outcomes, from occurring in the future. M&M conferences are not intended to assign blame or punishment for adverse outcomes, but rather to facilitate a collaborative and constructive process for improving patient care and safety. And another tool for promoting patient safety and quality of care is the audit. Audits are systematic and objective reviews of healthcare facilities, policies, processes, and procedures to assess their compliance with established standards and protocols. In the healthcare settings, audits can be conducted on various aspects of patient care, such as medication administration, infection control, documentation practices. The audit process typically involves a review of patient charts and observation of clinical practices, and can be interviews with healthcare providers to assess their knowledge and adherence to established protocols. The goal of an audit is to identify areas, again, where the facilities, processes, or practices may be falling short of established standards or guidelines, and to develop and implement strategies to address these deficiencies. The audit process can help healthcare facilities improve the quality of care they provided and reduce the risk of adverse outcomes and ensure regulatory compliance. One important aspect of audits is that they should be conducted in a non-punitive, non-threatening manner. The focus of the audit should be identifying the opportunities for improvement and developing strategies to address any identified issues, rather than assigning blame and punishing individuals for mistake. Overall, audits are an important tool for promoting quality and safety in healthcare settings. By regularly reviewing and assessing the effectiveness of their processes and practices, healthcare facilities can continuously improve the care they provide to patients and ensure that they are meeting established standards and guidelines. I would like to finish my video with a case. A 35-year-old woman with diabetes was not monitored properly and did not receive insulin during a routine hospital stay. This caused a severe hyperglycemic episode, and the patient was transferred to the ICU. A morbidity and mortality conference identified areas for improvement, including better communication, developing protocols for diabetes management, and providing education for healthcare providers. The hospital implemented changes, including a diabetes management control protocol, education program, and a multidisciplinary team. A follow-up audit found improved compliance, reduced hyperglycemic episodes, and better communication among healthcare providers. This case emphasizes the importance of conducting audits to improve patient care and safety. So what's happening is here there is an unwanted adverse outcome which is unexpected, and it is not a mistake of a professional body. So it is not a mistake, but it's an unwanted thing that happens, and it's an incident. So, and these are happening. So there should be reason for that to be happen, right? And healthcare providers are having a meeting, take a look at it, what might be the cause of it, and how can we come up with a strategy to prevent this from happening in the future again. So this is M&M meeting, and in the M&M meeting they are having some decisions like new protocols, and they are starting to implement these strategies to their new patients. And a medical team, a healthcare provider team comes and do some audits after some time and compare the data before and after the strategies, implemented strategies, and they can see the difference. And this is the improvement of patient safety and the quality of care in healthcare settings, basically. Thank you for listening.